Hello and good evening. Welcome. This is QTV News and I'm Mumudu Gajaga. Thanks for joining us. Coming up in the news tonight, we give you main local, international and headlines over that we have. Gambians in Sierra Leone's second city, Bo, have been speaking to QTV about their experiences living there. The senior management team of the Ministry of Health have reviewed the draft National Health Policy and Strategic Plan 2021 to 2030, focusing on accessible health care for all. The Ministry of Information and Communication Infrastructure, MICI, says it has successfully completed a Plus Code pilot project, which is a digital addressing for the nation's capital, Banjul. In international news, India is having to deal with what is now the world's worst COVID-19 crisis. Those were the main news headlines, and now the news in detail. Welcome along, and if you're just joining us, this is QTV News. The Gambian community in Bo, Sierra Leone has been speaking to QTV's Aliou Cisse about life in Bo and how they coexist as Gambians with the local population. Bo is in the southern Sierra Leonean south and over 200 kilometers from the capital, Freetown. And more in this report, let's join Aliou Cisse.
Well, we are here in Bo, about over 200 kilometers from the capital city, Freetown, southern part of Sierra Leone, and I'm here with a sizable Gambian community who are here in Bo. I will just ask by asking them, can you introduce yourself?
My name is Omar Jani. Yes.
And you are?
Alhassan Jabi. Yeah, the chief of the Gambia community, Southern region.
As the chief of the Gambian community in the Southern region, how is the living condition here for Gambians from living in Bo here?
Well, in terms of the, we have been finding our living condition through mining diamond, but at this initial stage, the diamond, to get diamond is not too easy. So some of us have depend now on trading market, like gari, palm oil, and cola nut from here to the Gambia. But for the past 7 months, the road, even the road to Gambia have become an issue. There is blockage between Senegal and Guinea. That is one of our paramount problems today. I even discussed that in our meeting before the President, His Excellency Adama Barrow.
Well, how often do you go back to Gambia?
I was there in 2017. So some have been here for a while, they haven't gone, but some they go every, let's say, 6 months, 1 year.
And what did you find out when you went to Gambia?
Yeah, I've found a lot of difference, and there's a bit more freedom in Gambia. People express themselves, and there's like a, I don't know how to describe it. It's like a new baby. I would say this is our embassy in the south of Sierra Leone.
That's where we are here right now.
Where we are here right now, so that we come together here because we are different tribes. You have Wolofs, you have the Maninka, you have the Sarahule. You know, you have the Jahanka. We are all here together as one because we are far away from our home, but here we are as one family. So we come together here, we have monthly meetings on that where we are sitting here so that we discuss our issues. So anybody who knows a Gambian going through certain difficulties, we come to his aid or her aid.
Those are the views of Gambians who are here in Bo. As you have heard from them, I mean, there are families in this area who really wants to go back home, and they're appealing for the government to help them. And not only that, even the issue of the border crisis between Senegal and Guinea is something they would like to see the government intervene. But then, as I said, I mean, there's so much unity among them here, and that is quite very significant as far as, you know, Gambians outside the country is concerned. This is something that everybody outside the Gambia should learn from, having that unity among themselves and trying to support each other. For QTV News from Bo in Sierra Leone, I am Aliou Cisse.
Aliou Cisse reporting there from Bo, Sierra Leone. The senior management team of the Ministry of Health on Tuesday met to review the draft National Health Policy and Strategic Plan 2021 to 2030, focusing on accessible health care for all. Abibatu Cisse reports.
Achieving universal health care is one of the targets the nations of the world set when adopting the Sustainable Development Goals in 2015. Countries reaffirmed this commitment at the United Nations General Assembly high-level meeting on achieving universal health care in 2019. Over the years, there has been conclusive data to show that good health allows children to learn and adults to earn, helps people escape from poverty, and provides the basis for long-term economic development. The draft policy document focused on key areas to provide a guide to the Gambia's Ministry of Health as a roadmap to accessible health care for all by 2030. Presenting the draft document by the Director of Planning and Information at the Ministry of Health, Jibril Jaju, says the policy development process started with a stakeholders forum to review the old document. A roadmap was developed and training conducted by WHO to guide the policy formulation process and a nationwide consultation. The Permanent Secretary 1 at the Ministry of Health, Mr. Mohamed Lamin Jaite, explains the importance of the drafting of a new health policy document.
Existing health policy expired in the year 2020, and we need a robust and very well efficient and improved successor plan that can see us through to 2030. And therefore, through all your technical inputs, we are here gathered to yet look at the draft that have been produced so far in the various chapters that you have all contributed to, so that at the end of the day we can enrich it further, so that we can have a finalized document in record time.
The Minister for Health, Dr. Ahmadou Lamin Samate, says the health policy and strategic document is important for the attainment of universal health coverage.
The policy and the strategy development processes were divided into phases, and this particular meeting with the senior management team of the ministry is one of them, and it is geared towards producing a high consensus policy document or high consensus policy and strategy documents for improved service delivery.
Modun Jai, the Director for Health Promotion and Education at the Ministry of Health, highlights significant priority areas of the draft National Health Policy.
I've also been able to spot key component which is about multi-sectoral collaboration, partnership, and also the issue of ensuring that we have health in all policies, as enshrined in the Helsinki Declaration of Health Promotion in 2013. This is a very important milestone for this policy. If this happens, meaning we need to see health featuring in all policies of government, which is good. And we have also seen the issue of the focus on maternal and child health, which is also good, and also adolescent health, which is very great ideas. These are great concepts, and great achievement will be registered.
The draft National Health Policy and Strategic Plan, when validated, will provide a general plan of action to guide the Ministry of Health in providing quality, affordable, and accessible health care. The United Nations stands ready to assist member states in these endeavors. However, making universal health coverage a reality by 2030 depends first and foremost on bold national leadership. For QTV News, I am Abibatu Sise.
UNICEF Banjul office on Wednesday donated office materials to the Department of Birth and Death Registration unit under the Ministry of Health. Without data, population statistics and other demographic data become pure guesswork. The equipment will help modernize the recording of births and deaths. Babu Karsi has the rest of the story.
The donated items include desktop computers, laptops, tablets, printing machines, photocopies, to name a few. The materials are for the Registrar of Birth and Death Department at the Ministry of Health. At the event, the head of the unit, Lamin B. Fati, thanked UNICEF for once again demonstrating their continuous support to the unit, which they have been doing since 2000.
With their support, remarkable achievements have been recorded or achieved in the country. Key among them was, in 2000, the registration rate was 32%. With the support of UNICEF, the country rose to 52% in 4 years. And because of this, the UNICEF program supporting the Ministry of Health to ensure that our decentralization and integration of birth registration processing into reproductive and child health services. That led to the creation of the Ministry of Health to create 73 registration centers and 252 outlets where registration can be held and certificate will be issued at the regional level instead of people traveling all the way from Bolibana to Banjul for a certificate.
Samba Balde, a representative from the UNICEF country office, said they have realized that the birth and death unit is struggling to gather data for registration of accurate childbirth and death in the country and hope that the materials donated will help eradicate this.
Every child birth should be registered and issued with a birth certificate within a recognized government institution, that is the Ministry of Health. In 2018, the multiple indicator cluster survey revealed that 57.9% of children under 5 years old communities had their birth certificate. We later noticed that almost 20% of children who have been registered did not have access to their birth certificates. There is still a lot to do, ensure that all children in the Gambia obtain their right to birth registration, and we are lagging behind in our objective to reach 100% of birth registration in 2030.
For the Permanent Secretary 1 at the Ministry of Health, Mr. Mamadou Lamin Jaite, the donated materials will boost the birth registration unit, as up till now, the country has been using the manual system to register birth data.
These are vital equipment that are required by our birth registration system to maintain a sustainable and efficient digitization of the birth registration system in the Gambia. You will all recall that until now, the Gambia has been maintaining and registering children in this country using manual recording system. This has become archaic because it is associated with a lot of efficiency issues. Management of records and the preservation of information has become a challenge for the Ministry of Health. And in this regard, we, through the partnership, strong collaboration and support from the UNICEF, we have been receiving support. And the UNICEF has been at the forefront of that support to make sure our birth registration system continues to be strengthened.
The Ministry of Health officials promised to use the donated equipment to digitalize birth registration in the Gambia to modernize a system that has not changed since independence. Babu Karsi, QTV News.
Now, the Ministry of Information and Communication Infrastructure, MIC, says it has successfully completed a Plus Code pilot project, which is a digital addressing system in Banjul. What is next for the project and how is it going to be implemented? I went out to find out more. Leveraging the digital technology beginning in the Gambia's capital, Banjul. With this technology, unique identification of addresses of places and properties in Banjul is possible, both online and offline, using Google Plus codes. Sering Modupa, Principal ICT Officer, Ministry of Information Communication Infrastructure, is the project manager. He explains how the technology works.
So if you go to Banjul, you will realize that in each and every property there are address boards. So the reason for the two phases is more of the online and the offline. So for the online, you can use the plus code. For example, if I was to come to your place or any other place, you just easily give me the plus code. I input it on the Google map or any other third-party application map that is interoperable with the plus code. So it will navigate you directly to that particular location.
Banjul is only the first phase of the project. Even though Banjul has long had street names, having a digital addressing system could add value to the city, its residents and visitors who can easily identify addresses of properties and residents. For Mayoress Lohi Malik Low, having digitized addresses could help boost the commercial viability of the city council.
First and foremost, allow me to thank the Permanent Secretary, who happens to be a very dynamic lady of substance by the name of Mrs. Njai and her team. In Banjul here, particularly, we are grateful simply because this will help us to maximize our revenue, and also it will help where emergency occurs. Because now it's very, very easy for the fire service, for example, or the ambulance to trace individuals. It's just like a blink and they are there.
Banjul City Council and other agencies partnered to make the implementation of the project. How will the project work for the benefit of the public?
It is extremely important that we state that one of the important things that the addressing will do in this country is to ease the difficulties associated with identifying places. Like if you want to leave your home right now to come to, say, GRTS, if you don't know this place, you have to call and then you'll be given direction, and then sometimes you spend a lot of time trying to locate a place. But with the digital addressing system in place, I mean, all what you need to do is to type this address on your device, and then it will direct you.
The digital address is a key requirement for registration of citizens and residents. Digital addressing will now be the single most important tool for all citizens to locate government departments, business partners, friends and relatives accurately and quickly. However, you access this system with a smartphone. So what happens to those who do not have a smartphone or a laptop? And for those standing on a street corner asking for directions of someone who also doesn't have a smartphone? We will keep an eye on this. Mamudu Gajaga, QTV News. From that story, we will take our first commercial break, but still to come, we have local and international news for you. Do stay tuned.
Ramadan Mubarak from Ajib Bank Limited. This Ramadan, when you open a savings account with Ajib Bank Limited, you will receive a free passbook. And when you open a current or salary account with the bank, you will receive a checkbook for free. Ajib Bank Limited is the only Islamic bank in the Gambia, and we share profits with our clients. So why wait? Visit any Ajib Bank Limited branch today and open your savings account, current or salary account, and enjoy the halal beauty of Islamic banking in line with the Sharia. Ajib Bank Limited, your investment partner.
Welcome back, and if you're just joining us, this is QTV News. Action Aid International and in the Gambia, with support from the UNDP on Saturday, organized a day-long town hall meeting at Churchillstown Conference Hall with leaders from the Canifing Municipal Council KMC and citizens to jointly discuss the progress made in implementing the Citizens Local Demand Charter. Omar P. Jala was there, and he now reports.
The discussion centered on the Council Strategies Development Plan under the theme Strengthening Inclusive Citizens Engagement for More Accountable Governance in the Gambia 2020-2021. The two-year project is funded by the UN Peace Building Fund and implemented by the UNDP and Action Aid International the Gambia. Welcoming the participants, the CEO of Canifing Municipal Council, Senabu Martin Sonko, commended UNDP and Action Aid International the Gambia for the initiative and gave a rundown of some of her council's development projects, including the installation of a digital revenue collection system to enhance transparency, staff performance appraisals, constructions of market and roads, waste management, amongst others.
We started this process not long ago when we interacted to hear from the citizens of the municipality what they expect in terms of how services or development will be achieved in the municipality.
The Executive Director of Action Aid International the Gambia, Omar Baji, said it is only through good governance that effective and efficient use of resources can be guaranteed, and development efforts can meet the needs of the people and yield the desired results. Baji added that poor governance can be destructive as it could result in corruption and inequality, as opposed to good governance, which enhances transparency and accountability.
These types of interface exercises should not be a one-off activity. The councils must continue to hold such forums to ensure that the people take part in decisions that affect their lives and livelihoods. Excluding the people from these decisions can cause frustrations, which can lead to undesirable outcomes.
In the keynote address, the UNDP resident representative, Aissata Day, said such inclusive engagement between the duty bearers and right holders are important in improving performance, transparency and accountability amongst the leaders, and will promote participation of citizens in decision-making processes and subsequently strengthen local democracy, development and peace. Adding that this is in line with the Sustainable Development Goal 16, which aims to promote peaceful and inclusive societies for sustainable development and building effective, accountable and inclusive institutions.
A close collaboration with the council and the municipalities is key. It's key in the sense that we can promote and provide this type of space where the citizen can, on a regular basis, have an interactions with a councillor, with a member of the municipality, and really do an in-depth analysis of what are the key aspirations and how to roll out the charter and every strategy that have been defined in a very consultative manner.
The aim of the project is to support ongoing efforts of the country's transition from an autocratic to democratic governance through the facilitation of more transparent and inclusive exchanges between rights holders and duty bearers, with a view to improve performance amongst public sector leaders, as well as strengthening dialogue of political parties and actors to avoid further political polarization. Reporting for QTV News, I am Omar P. Jallo.
The Gambia Police Force and stakeholders on Thursday met to discuss a strategic framework and roadmap to attain the goals set for the police up to 2023. Loli M. Kamara attended the ceremony and see files in this report.
Stakeholders from various government institutions and international partners met to review the recommendations and the way forward for the Gambia Police Force to achieve its 2021-2023 development goals. The aim of the forum is to advance the police and guide them in delivering the highest quality of service to the nation. Addressing the participants, Momodu Sow, Deputy Inspector General of Police, states that the meeting will add value to the work of the police force.
The rationale for today's consultative seminar is to create and maintain an operational harmony between the Gambia Police and its esteemed stakeholders, to focus on new strategic directions, whereby eliminating unnecessary duplications and improve coordination, collaborations towards achieving our common goals. The importance of today's gathering cannot be overemphasized, as it creates a platform from our esteemed stakeholders to register their valuable concerns and contributions into the said strategic document for a better comprehensive, effective coordination, as well as to enable them align their activities with the said blueprint to ensure local ownership on their development intervention supports.
Superintendent Sambu Jamfati from Policy, Planning and Training Office of the Gambia Police Force outlined the reason for the police having a strategic document.
During today's deliberations, we are going to talk about a host of issues, particularly when it comes to the strategic guidance framework, the areas, the administration, the capacity building aspect, as well as authority, command and control. And we're also going to take into account areas such as the comprehensive institutional needs assessment. This is going to be the foundation or the baseline for subsequent roadmap. And the roadmap is going to specify every aspect of police reforms, so that as a police institution, we are able to respond effectively and efficiently to the needs of the communities that we serve.
Lamin Banda, Regional Police Commissioner in LRR and a participant, says such a document is long overdue and will help police focus on reshaping their work.
I think it's a moment that the police are trying to retrospectively take stock of things that were not working right in the previous regime, culminating into that gap being created between the police personnel and the members of the public that they intend serving in terms of meeting their expectations and stuff. So going by that trajectory, I think the fact is this would give police an insight into the gaps, and then solicit funding in terms of capacity development, in terms of logistical support, in terms of improving on their manpower base.
The goals from the strategic framework and roadmap include the strengthening of community policing, crime-fighting strategies, staff welfare, and capacity building for staff, amongst others. For QTV News, Lolly M. Kamara.
Prime Minister Narendra Modi has urged fellow Indians to exercise patience and get vaccinated as the country battles a second wave of COVID-19 that has brought the country's health sector to its knees.